Hi everyone and welcome. Today we're discussing postpartum depression, an important topic for new mothers and their families. If you're a new mom, or if you love a new mom, this video is for you. We'll break down the symptoms, causes and treatments based on reliable information from the Cleveland Clinic. What is postpartum depression? It's a mood disorder affecting women after childbirth. Intense sadness, anxiety, and exhaustion can make it hard to care for yourself and your baby. It's not a sign of weakness or being a bad mother. It's a real medical condition, and like any medical condition, it's treatable. Postpartum depression isn't one size fits all. It can range from mild to severe. Some women experience baby blues, feeling overwhelmed and emotional after delivery. But for others, it goes deeper, lasting longer and affecting daily life intensely. Let's talk about the baby blues. These are common ups and downs many new mums face. You might feel teary-eyed for no reason or more sensitive than usual. These feelings are normal and usually pass within a couple of weeks. Postpartum depression is different. It's more intense and lasts longer than the baby blues. Feeling overwhelmingly sad or hopeless for weeks, maybe even months. It's hard to find joy in things you used to love. These feelings can make daily life tough, and that's when it's important to reach out for help. Postpartum psychosis is the least common form of postpartum mood disorders, but it's the most serious. This is when a woman experiences a break from reality, with symptoms like hallucinations, delusions, and paranoia. This is an emergency situation, and it requires immediate medical attention. If you or someone you know is experiencing these symptoms, please call 911 or go to the nearest emergency room. Postpartum depression is more common than you might think. Studies show that 1 in 7 women experience postpartum depression after giving birth. That's a significant number of mothers. Yet, it's often swept under the rug. We need to break the stigma and create a space where women feel comfortable talking and seeking help. It can be tricky to tell the difference between the baby blues and postpartum depression, especially in those early weeks. If your symptoms are intense, last longer than a couple of weeks, or interfere with caring for yourself or your baby, it's time to reach out to a healthcare professional. There's no magic timeline for recovery from postpartum depression. Every woman's journey is different. For some, symptoms might ease up within months with the right treatment and support. For others, it might take longer. What are some factors that can increase a woman's risk of developing postpartum depression? A history of depression or anxiety, complications during pregnancy or delivery, and a lack of social support can play a role. Even hormonal changes after childbirth can contribute. Remember, these are just risk factors, not guarantees. Postpartum depression can manifest in different ways for different women. But there are common symptoms to look out for, and it's important to understand the causes. Knowledge is power. So let's dive into what's going on in your body and mind. Postpartum depression can show up in many ways. Some women experience intense sadness and hopelessness, while others feel irritable and agitated. You might withdraw from loved ones or feel anxious and overwhelmed. Changes in appetite, difficulty sleeping, and loss of interest in activities are also common. Remember, you don't need all these symptoms to be struggling with postpartum depression. Postpartum depression is complex, often caused by a combination of factors. Hormonal changes after childbirth can play a huge role, as can genetics and family history. Life stressors like relationship issues, financial worries, or a difficult birth can also contribute. Some symptoms need immediate medical attention. If you have thoughts of harming yourself or your baby, hallucinations, delusions, or feel out of control, seek help immediately. These are signs of a serious condition needing urgent intervention. When a mother is struggling with postpartum depression, it can affect her bond with her baby. It can be hard to muster the energy to play or interact, and you might feel emotionally distant, but remember, it's not your fault. With the right treatment and support, you can build a strong bond with your baby. Getting a diagnosis is the first step toward feeling better. It's crucial to discuss your symptoms with your healthcare provider. Diagnosing postpartum depression involves several steps. Your doctor will discuss your symptoms, their duration and severity. They might also ask you to complete a mood and emotional well-being questionnaire. There's no single test for postpartum depression, but these steps help your doctor understand your condition. Many healthcare providers now routinely screen new mothers for postpartum depression during their postpartum checkups. These screenings often involve filling out a questionnaire about your mood, sleep, appetite, and other symptoms. Early detection is crucial because it allows you to get the help and support you need sooner rather than later. The good news is that postpartum depression is treatable, and there are effective options to help you feel like yourself again. Treatment usually involves therapy, medication, and lifestyle changes. Treating postpartum depression is about finding the right combination of therapies that work for you. Therapy, particularly cognitive behavioral therapy, CBT, can help you identify and change negative thought patterns and behaviors. Medications like antidepressants help to rebalance your brain chemistry. And lifestyle changes like getting enough sleep, eating a healthy diet, and exercising regularly can make a world of difference. Antidepressants are often prescribed to treat postpartum depression. These medications increase certain chemicals in your brain that regulate mood. Discuss the benefits and risks with your doctor to find the right medication and dosage for you. In addition to professional treatment, there are things you can do on your own to manage symptoms and feel better. Make sure you're getting enough sleep, even if it means asking for help with the baby. Engage in activities you enjoy, even if it's just for a few minutes daily. If postpartum depression is left untreated, it can have long-term consequences for both the mother and her baby. It can strain relationships, make it hard to bond with your baby, and increase the risk of chronic depression. That's why it's crucial to seek professional help if you're struggling. While there's no guaranteed way to prevent postpartum depression, there are steps you can take to reduce your risk. Taking care of your mental health, building a strong support system, and talking to your doctor about risk factors can all make a difference. Research suggests that certain strategies might help reduce the risk of postpartum depression. These include regular exercise during pregnancy, eating a healthy diet, practicing stress reduction techniques like meditation or yoga, and attending childbirth and parenting classes to feel more prepared. The good news is that with the right treatment and support, most women recover from postpartum depression. It might take time and effort, but it is possible to feel like yourself again. Research indicates that most women undergoing treatment for postpartum depression see a marked improvement in their symptoms. Recovery is achievable, offering hope for a brighter future. Living with postpartum depression can be challenging, but there are ways to make it easier. Be kind to yourself, practice self-care, and ask for help when needed. If you're experiencing any of the symptoms we've discussed, or if you're just not feeling like yourself, please don't hesitate to reach out to your doctor or a mental health professional. You truly deserve support, and there is help available. Let's take a look at some of the most frequently asked questions and concerns about postpartum depression and its effects. While postpartum anxiety and postpartum depression share some similarities, they are distinct conditions. Postpartum anxiety is marked by excessive worry, fear, and racing thoughts, while postpartum depression involves persistent sadness, hopelessness, and loss of interest. It's possible to experience both simultaneously. Postpartum depression isn't just a mum thing, fathers can experience it too. Partners should be aware of the signs and symptoms of male postpartum depression and seek support if they're struggling. Postpartum dysphoria is a term used to describe a range of mood and emotional changes that can occur after childbirth, including feelings of sadness, anxiety, irritability, and overwhelm. It's important to remember you're not alone if you're experiencing these feelings. If you know someone struggling with postpartum depression, the best thing you can do is offer support. Listen without judgment, offer practical help, and encourage them to seek professional help. Postpartum depression is a serious condition, but it's important to remember that it's treatable. If you're struggling, please know that you're not alone, and there is hope. With the right support, you can recover and embrace motherhood.